Good afternoon. I want to thank everybody who joins us. My name is Olena, and it's my pleasure to see all of you here in a Brain Hub, the main Ukrainian discussion platform created by Ukraine Media Center Ukrinform. Today is day 517 of the full-scale invasion of our homeland by Russian aggressor. It's been 10 years of the war, and now we will be talking about misinformation launched against us by Russia, by our enemy. So our topic today is chemical weapons, biolaboratories, and nuclear provocations, how Russia lies about the health of Ukrainians. So I want to introduce our speakers today. Right by my side is Svitlana Slipchenko, VoxCheck project manager, Anayit Khoperiya, head of the Department for Countering Information Threats to National Security at the Center for Countering Misinformation under National Security and Defense Council of Ukraine. Also joining us is Mykola Balaban, deputy head at the Center for Strategic Communications and Information Security, and Zvenislava Sherba, analyst and journalist at Internews Ukraine NGO. Also was about to join us Olena Hlyvynska, USAID Health Reform Support project, but she will only have an address to us. Dear journalists, it's my pleasure to see all of you here during our event. My name is Olena Hlyvynska. I'm the communications manager at USAID Health Reform Support project. More than 1.5 years we work with VoxCheck, our wonderful partners, on implementation of a very important activity for Ukraine, the debunking of myth in the area of healthcare. Why we decided to undertake this initiative to implement this campaign. Our project provides the technical support to the Ministry of Healthcare of Ukraine, National Healthcare Service of Ukraine, in implementation of healthcare reforms. And since with the beginning of the full-scale aggression which Russia started in February 2024, the information space is saturated with the myth, with the Russian myth about the functioning of the Ukrainian healthcare system. Russia spreads a lot of fakes. Our information environment was so densely saturated with those fakes, we decided to implement this initiative because it's an important layer of the healthcare system which influences the perception by the community, by the society. So we continue monitoring the information space of Ukraine, Russia, and Belarus. We processed and debunked more than 91 fakes. We prepare information materials which explain how people should react to such fakes, to such misinformation, where to look for faithful information, what for sources of information to use. And our initiative was supported and very well perceived by the patients, by the society. Our campaign covered the audience of 44 million people, and we continue this activity. We do not cease it. We will continue it next year because there is a demand and there is a support by our national partners, such as the Ministry of Healthcare of Ukraine. They post our materials, they comment on any hot topic. We use only verified information from them. And I hope that today's event will be of interest to you because we work for you, we prepare information for you, something that would be of interest to you, the information from the first sources. I wish everybody productive work today and see you shortly during events like this. Thank you very much, Miss Olena, Miss Svitlana. VoxCheck works systemically on monitoring and analysis of this situation that is unfolding in the media space. You've studied the media space of Ukraine, Russia, and Belarus, so what are the conclusions that you have drawn? You know well, we know that you have generalized all the information in your database, how to use that database, what was included there, and what are the trends and cases that you observe, what do Russians use, what are the techniques they use, and the channels of communication. Good afternoon, everybody. Really, VoxCheck in coordination with USAID Healthcare Support Project studies misinformation in the area of healthcare system of Ukraine and what Russian and Belarusian media spread in the media space, social networks, and those Russian channels that try to mimicry Ukrainian ones. Within this period, we documented almost 1900 cases of misinformation about the system of healthcare of Ukraine. Once again, I want to emphasize almost 2000 news in different platforms which one way or another disputed or discredited the system of healthcare of Ukraine and put lives and health of Ukrainians under threat. We grouped those cases in 143 fakes currently existing, the unique topics that Russian information sources were manipulating to undermine the access of Ukrainians to the healthcare system. And it can all be generalized in 15 main categories. And that massive of information is available in our database Detox, the propaganda detox. And I propose you to check out the presentation. I'm asking our technical team to put the presentation on the screen. So as soon as you go to the website of Propaganda Detox, you see the start page where you can read about the project, its methodology, download all the database, I mean almost 2000 cases. You can analyze it by yourself. It's available in Ukrainian, Russian, and English languages. And apart from the documented cases, it also contains videos, debunked fakes, the videos that explain what is this misinformation, and also in the database you can see the extended articles debunking all the myth about the healthcare system of Ukraine and infographics that you can use in your materials. Also, we have interactive visualizations in our start page that allow you to see key trends and topics of Russian propaganda regarding the health of Ukrainians. As you can see, as of today, within the year of observations since June 2022 until June this year, the top topics, well, it was kind of surprising for us when we compiled all the data. The topic of chemical threats for Ukrainians, then biolaboratories of the United States, which were mentioned umpteen times in the multiple platforms. Russia manipulates a lot about so-called secret laboratories of the United States. There is also a topic of humanitarian crisis and catastrophe, the topic of grain, which is quite actual now. Many topics are related to nuclear threats, provocations at Zaporizhzhia nuclear power plant, as to the militarization of the hospitals, as if armed forces of Ukraine capture the hospitals, destroy them, and so on and so forth. And obviously the topics related to the eruption of epidemics and discrediting of the healthcare system in general, meaning the activities of doctors, medical reforms, and so on and so forth. So generally the healthcare system in our approach is way broader because it covers not only the system itself but also the topics which one way or another are related to the health of Ukrainians. If you want to use the search function in the database, you can search by keywords or by main tags that correspond to the main topics in the database. If you choose the tag, you can see the list of fakes that were debunked related to that topic. This is what it looks like on the example of the grain topic, one of the most actual within the last 2 weeks. So this is what the debunking of every specific myth looks like. You can see the sources of spreading. Once again, those sources can be Russian, Belarusian media, or social networks such as Telegram or Facebook. So those are the main channels through which Russia launches the information, the fakes about the healthcare system. So you see what is the wording of the fake of Russian propaganda and what the debunking looks like. The debunking contains the references to the verified information. You can also see the so-called topics, the narratives. There are 15 of them, as I mentioned in the database, and among the latest ones that we added within the last couple of months of observation is the donorship of blood that was this topic discredited by Russian sources. For example, there are cases that as if NATO handed over contaminated blood to Ukrainians, or the high school students are forced to donate blood in some regions of Ukraine. It's all myth which is aimed at provoking panic among Ukrainians, including probably military. Also, the database contains useful infographics that you can use in your materials, because the key information about the topics that are mostly targeted by Russian propaganda are grouped there. I'm talking about the healthcare system. Thank you very much, Ms. Svitlana. I would like to ask you about the channels. You say that the propaganda is spread in Russian and Belarusian resources. Does it mean that our people consume that product, or is it a start and then from those sources, the Telegram channels of different levels, pick up that information and spread it among our audience? Well, mostly Russian and Belarusian media are the start, and then mostly through social networks, specifically through Telegram, fakes start migrating to the Ukrainian information environment. Very rarely Ukrainian media may pick up Russian fakes, but there are pro-Russian channels, those that speak about Ukrainian context, but in fact they word for word repeat the narratives from Russian channels, and they are the ones who spread misinformation, mostly specifically the myth about the healthcare system. It's happening mostly in Telegram, but we cannot say that they are the point of concentration of evil. The fakes migrate to Instagram, to Facebook, and a part of such sources. I would also mention that the topic of health of Ukrainians is undermined by a number of anti-scientific articles, and the topics related to folk medicine, something that is not clinically proven. There was an eruption of this topic during COVID-19 pandemics, on par with all other fakes related to vaccination, to pandemics, but even now you can find numerous articles that propose anti-scientific methods of treatment, which undermines the trust to the system of healthcare, to the doctors, to the scientifically proven medical practices or scientific approaches to treatment. Ms. Venislava, I would like to ask you, as a journalist, I'm curious, what are the cases that you were facing during your work? What have you been impressed with mostly, and how can the civil society influence on debunking those myths, that misinformation? Thank you for your question. The topic of misinformation in the area of healthcare is a component of Russian propaganda, and as it was mentioned, it's aimed at the audience both inside Russia and in Ukraine to destabilize the situation in Ukraine, to provoke mistrust towards healthcare system and the government. And an interesting aspect is that some of the narratives, we could notice them even in Western media when we were monitoring those narratives. Mostly they were pro-Russian sources of information. However, the narratives about biological weapons were emergent there as well. So during our work, the narratives that we were able to segregate can be divided in 4 bigger categories. They are the use of biological weapons, the so-called topic of the black transplantology, then the chemical and nuclear threats, and the topic of militarization of different infrastructure facilities of Ukraine. So talking about biological weapons narrative, for example, it was mentioned properly, it's related to that narrative of the Western biolaboratories or United States, which is a popular narrative in the Russian information space, but it also was emerging in Ukrainian information space as well, mostly in social media. Those messages were published mostly through the statements of some specific people or through anonymous Telegram channels or some communities. And their idea was to accuse Ukrainian authorities of preparation or tests of biological weapon doing harm to their citizens, and on the other hand, those narratives were aimed at accusing the Western countries of using Ukraine as a polygon for testing biological weapons and testing those bioweapons on Ukrainians and Russians. To confirm those messages, they were using so-called proofs, the evidences by the people who were introducing themselves as the employees of such laboratories, or statistical data from Russian Ministry of Defense, or the data from occupational administrations, which were talking about the documenting of the facts of identification of biolaboratories in temporarily occupied territories of Ukraine. Sometimes they reference different Western opinion leaders. For example, the Russian media likes to quote Tucker Carlson. He's a pro-Russian American actor who is famous for, or infamous for, statements like that. If we talk about the narratives related to chemical nuclear threat, the goals of spreading such narratives are identical, but I would like to focus on the narrative about the black transplantology, because it's something that emerges in the information environment quite frequently, and it's aimed mostly at the military. There are messages that to conceal the losses, the Ukrainian party tries to engage the black transplantologists in the front lines, and thus Ukraine is paying the West for the weapons supplied, which confirms another narrative of Russian propaganda, who sees where Ukraine is seen as the colony of the United States or the West. The other thing that we have documented lately is that the narratives become more and more related to the children. For example, that the orphans from Ukraine are being deported from Ukraine to EU to trade their intestines and or organs. Well, this information emerged after the information about the mass deportation of Ukrainian children of Ukraine, and now Russia tries to create this black and white picture where they, so to say, saves the Ukrainian children, and Ukraine and the Western countries use them for purposes like those. And the topic of militarization of hospitals, talking about that, it's mostly aimed at Russian audience, but its harm is in fact that the attacks on the Ukrainian medical facilities and the victims among the patients is justified, that those hospitals or medical facilities were used as a militarized facilities, so it's a justification for the attack on healthcare facilities of Ukraine. It's not a new topic. Back in May, we represented a report of UPR with my colleagues where we analyzed the Russian propaganda narratives and how Russia uses those narratives in information war against Ukraine. So the hottest topic back then was misinformation around COVID-19, and those narratives were tightly related with the anti-vaccination narratives. There were messages about the non-efficiency of Western vaccines, the artificial breeding of the virus in laboratories of the West or United States or even Ukraine. And the methods for spreading such narratives were the manipulation with facts. So frequently they just take a fact and which is referencing some reputed source, but the key part, some facts, are distorted, they are non-true. So thus Russian propaganda is trying to create so-called evidence base. So to summarize, the misinformation in the area of healthcare is aimed at Ukrainian audience in the same way as to the people inside Russia, It's aimed to support other Russian narratives about the corruption of Ukrainian authorities, the use of Ukraine by the West for achievement of their goals, and to justification of attacks on Russia, and such sensitive topics as nuclear threat, chemical threat, biological threat, black transplantology. They play on human fears, on emotions, and those emotions and fears can be used by Russian propaganda for promotion of other narratives of theirs and destabilization inside Ukraine. Thank you, dear friends. It's no secret to anybody that Russian psyops work. They try to influence any areas of our life. Ms. Anayit, I want to ask you, what are the operations that you had to work with to counter Russian narratives lately? I would like to hear a couple of cases from you. Thank you. The Center for Countering Misinformation documents all the psyops that are being spread by Russia about CBRN attacks, for example. We try to debunk them on the initial stages. For example, the campaign about the contaminated or infected blood, we found it in Telegram channel in Russian language, which is called Mesh, with more than 1 million subscribers. Frequently they post fake news there, or the fake letters. That was a fake letter by Minister Leshko about the contaminated blood from NATO, and we debunked it in the following way. As soon as we get the information about any threats that are related to any government authority, we forward it to the ministry, they reacted, and to support the information posted by them, we help them to promulgate that it was fake, and we debunked it on the initial stage. We've even counted, we've made it within 3 hours only. But talking about the big scale or large scale campaigns, I would like to focus on the black transplantology, because the Center for Countering Misinformation posted the research on their website, so I would like to get a little bit more profound in this topic. The most combined threat is in this topic because it involves children, as it was said by the previous speaker, and with the refugees. So first of all, it started with the year 2014. Russians are inspired by our vulnerabilities. They find the case that really existed. There was a hospital, and six doctors were convicted for black transplantology. So they are inspired by such vulnerabilities, and they started using cases like that. So during the Revolution of Dignity, they were using those narratives, like Maidan Reapers or something like this. The story with the black transplantologist started in crematorium, and in 2015 there was a video with the serviceman of State Security Service of Ukraine with his face covered, and he tells how it happens in the battlefield, that there is Debru, a woman whose name is Debru. Well, we found out that such person does not exist, and she was as if from Holland, and she's related to the wife of Mr. Saakashvili, and Saakashvili was in control of this story. Well, it looks funny, but in reality, in 2015, Security Service of Ukraine obviously debunked that video, but until this very moment they continue using this video in TikTok, and we've documented it in 2022. Then they started using the story with Miss Olena Suprun, everything related to America and so on and so forth, and the medical reform. And on top of that, that narrative started fading in 2018, but in 2022 the active warfare started, and those attacks about the black transplantology have started again. They manipulated a lot with the statement of Minister of Defense of Germany about the delivery of mobile crematoriums to us, and they used it to manipulate the topic, like, look, now all of the military will be ripped and burnt in crematoriums. And then there was a time for combined news with the refugees. Our people live, and they live for a reason. Nobody documents it, there is no register of the people living, and if anybody gets lost, so let it be. Then those who get lost, their organs will be transplanted. And then even Patrushev was using those topics about the refugees who are under threat in the Western countries. Then talking about the international factor, we were documenting many times in Spanish-speaking, mostly in Spanish-speaking media, the articles about the black transplantology. Even in Italy there is I have a name here, there is an expert, his name is, I'll tell you right now, so you don't succumb to that fake, Alfredo Delincelli. So he posts articles in the editorial Politicamente Correcta. Such expert or journalist just does not exist. So on his behalf, there are articles posted all the time discrediting Ukrainians and Ukraine, specifically on behalf of this person. And Russians also posted a video with the watermark of Russian Kaluga channel Nico in Twitter. There were more than 1,000 retweets. There was no mentioning of Ukraine, or it was as if related to Izum, to Ukraine, that there were cases of black transplantology there. And they posted that video right away with English subtitles. So it was aimed at the Western audience. And that spreading, it happened, and why it was related to Izum and Ukraine, it was done through the bots. Bots started commenting that video, and thanks to the bots, the so-called international audience have realized that black transplantology cases were having place in Izum. Then those cars, the medical cars of the children in Mariupol, like Red Cross documented the cases of black transplantology there as well. And what seems to me a culmination, it was in May this year, there was a video about Tanks for Barrels, a documentary, and all those videos about the brew, about our security servicemen, everything that we were documenting since 2014, you know, it just coincided so that we were studying this issue, and in May we see this video and we see the full chronology of what they were doing. So this video, or I apologize, a documentary, it was translated into English language, and they started spreading it, and all those people who commented there, they've taken some international experts, journalists, unfortunately. It was made quite well for their audience, and I can state one thing, that yes, they tried to develop this topic, they related to children, to refugees, to different categories, but that narrative, it lives since 2014, and we still need to take a lot of efforts to make sure that apart from our audience, let alone the Russian, so we have to debunk it in front of our and international audience, because it's being spread there, it's been promulgated, and we have to be very proactive in this area. We have to continue working to ensure the security of information space of Ukraine. Thank you very much. Mr. Mikola, what does the Center of Strategic Communications document? What are the narratives that are most popular now? Do really all of them work? Can we document that there is a transformation of Russian narratives? How do they transform, and what do we understand? What doesn't work at all? For example, Thank you very much for your question, Luke. I would like to start with the fact that when we talk about, well, in our work in the center, we try to not to pick every single piece of fake or Russian misinformation, but we try to compile them into bigger categories. And the classic way of fighting disinformation is debunking, and you understand there is a response to Russian information psychological operations, since the psyops themselves are of a multi-layered nature. In the same way that response should be multi-layered too, and we are in this government design. We are on the side where we prepare different types of communication to make sure that this narrative does not become so popular. So apart from debunking, another layer is a pre-bunking. When we communicate actively with our colleagues from the civil society, we use their information, and respectively when we see any of those big sets of topics, as it was good described in the beginning, for example, about the chemical threats, we start creating, we start thinking, and we launch a process of preparation of different types of communications related or could help the Ukrainian society, the consumer of information from social media, to orient in the provide the consumers with maximum context, or we offer them to find the information about the chemical threats. So this next layer that you've asked, what does work and what doesn't work, so debugging as it is a little bit weak method that when we say no, this is not true, but it should be done one way or another. It's done by all the organizations represented here, but at the same time it's important to build some information campaigns or create information products that would explain to the Ukrainian society the context, the broad context of certain problems. For example, we may take from the beginning of the war, beginning of the full-scale invasion, we may take those Russian information activities. They were intensified significantly, and we've made a little, so within the framework of this concept, that we provide the society with the maximum context possible to make sure that the people who read that untrue information, they start having some sentiment towards that information, so that they were able to read some more reliable sources or to understand how to counter some chemical threat. This is why we have a project in a center called Dovedka Info. You can see it on the screen. It's a set of different advice, practical advice for different cases in your life. So we see there is a set of problems like a chemical threat, for example. There is a chemical threat, and in coordination with the colleagues from other government institutions, we work a set of communications, how to counter or what to do during CBRN attack, the chemical weapons attack. We describe different scenarios, different options. We prepare different types of contact. I would like to ask you to launch the YouTube video that we were showing. It's available in our YouTube channel, but it was also shown during television marathon and in the subway. So please launch it. What to do during the chemical threat. Remember the main rule: you hear the siren, go to the shelter. Compliance with this instruction may save you from chemical attack. If you have any suspicions of use of the chemical weapons and you are in the area where sirens are not available, if you identify unknown substances or liquids, the mass pestilence of birds or animals are the indicators of chemical attack. So leave the area as soon as possible and seek shelter. Try to minimize the contact with the environment. Remember, you have to breathe slowly so that less contaminants get into your organism. Don't eat or drink anything that could have been affected by chemical substances. Adhere with the instructions provided by the official sources of information. You see, it's a brief video, but if you scroll down, you can collect a lot of information there. And our idea is that prepared means pre-armed. So if Russians touch upon your emotions, if you've read about the chemical attacks, so talking about the biological or nuclear threats, we have small hubs with information there. So this is something that allows the people who end up facing this misinformation to read some more profound information. And the more the people learn about the context, it helps people not to let that information inside and not to spread it. And the same story is with different aspects, different topics that were mentioned here. Another important moment, important area where we work in is when we talk about some work with Russian misinformation. Like during COVID-19 pandemics, there was a lot of Russian misinformation of different types, starting with the best Sputnik vaccine, that only it works and none of the Western vaccines work, and ending with some Ukrainian or narratives aimed at Ukraine and Ukrainians, that Ukrainians don't want to get vaccinated, American vaccine is bad, Ukraine doesn't make it with vaccination. And we've made a big research, a big study about Ukrainian success story in Morshin, in the city of Morshin, which got vaccinated in their majority very quickly, very actively. And when Ukraine was under lockdowns, Morshin was one of the safest cities of Ukraine, and people started making memes about Morshin, like let's go to Morshin. So this is how we try and how we use the expertise of other institutions to communicate the problems to the society. What Ms. Anayit mentioned, the Russians use the vulnerabilities. The less vulnerabilities we have, the less components Russians will be able to use in their psyops against Ukrainian society. So this is it, I guess. Thank you very much. I would like to focus on the target audiences. Maybe some of you may answer, what do you observe? Whom this misinformation is aimed at? The misinformation in the area of healthcare. Is it internal audience or is it international audience? Because it's difficult to believe that it's Ukrainian audience, because recalling those biolaboratories in Ukraine, it's something that I want to believe that not too much Ukrainians believe this type of misinformation. But if you have any systematized data in this regard, so please, I would like to start the different narratives are targeting different audiences. If we talk about, for example, medical reforms discrediting the statements that Ukraine is incapable of coping with the eruptions of the infectious diseases or chemical or biological threats, in the same way the face spread by Russia about absence of medical examinations for the children in Ukraine, and Russia only renewed them for the deported children, and that Ukraine was not dealing with vaccination and only Russia resumed the vaccination for children. Those are the topics targeted at the residents of temporarily occupied territories, because they have to be convinced that Russia is better than Ukraine. Secondly, for Ukrainian audience to persuade those who are hesitating, or to make the broad audience doubt, do they really get normal medical aid in Ukrainian healthcare facilities. So this healthcare topic unfortunately works, and it's been frequently used by Russia because it's a sensitive topic. It's a topic important for every people because it's directly related to the lives of people. How do people feel, whether they will be able to get normal medical help, whether their lives can be saved just in case. So Russia exploits a lot of those topics. You see it in the observations of our colleagues. So the pool of topics that Russia covers is very broad. But talking about the foreign audience should be demonstrated that Ukraine is non-reliable and potentially dangerous to justify Russian aggression. This is why such topics flourish there, as the infections that Ukrainian refugees could spread. We've identified the case that Ukrainian refugees contributed to the growth of HIV and AIDS cases in European countries. However, the statistics had no relation to Ukrainian refugees. There were other cases where we were seeing that those cases of black transplantology and the topic of military biolaboratories, drug laboratories is among top 3 topics spread in Europe. Again, for the comparison, Russia justifies the necessity to start the war as frequently as they speak about the drug and biolaboratories functioning undercover in Ukraine, to show on one hand the threat emanating from Ukraine and to justify that that threat was existing for Russia, and Russia started in the special operation in response, and that Ukraine may be a dangerous and unreliable partner for the Europe. Maybe my colleagues have other observations. I would like to add a little bit that, look, if we, for example, take one specific narrative with biolaboratories, we have to understand that the target audience are of multi-layer nature. When we say that this is the fake, what was the target audience of these fakes? So it was aimed at dozens of target audiences. So are they Ukrainians or the foreigners or Russia? Well, it was spread everywhere. So the way we have to think, there is a roof on top, like a big narrative. There are biological labs in Ukraine. For Russian, conditionally speaking, there is a number of target audiences in Russia. So this message is being this narrative, I mean, is being broken down to a number of messages for different target audiences, and that same narrative abroad is broken down into a number of messages for different target audiences as well. For example, we know in Ukraine, in every society, there are people who believe in conspiracy theories. There are parts of the society who are inclined to believe in the conspiracy theories, and that fraction of society is a target audience, and for that target audience they tune this biolabs narrative so fine, so it's a component to a conspiracy theory. So there are, for example, discussions about the medicine, scientifically proven medicine. So for that target audience which is hesitating about our classical scientific medicine, that same narrative is tuned in a different way, so it becomes a different message. So talking about Ukrainians, I think everybody monitors that it was very roughly made, and it was not made for Ukrainians, but it's not aimed to convince people in Ukraine that there are biolabs here, but it should sow the seed of doubt, and it's one of the tactics to establish mistrust between the society and the government, between the denizens of some settlement and a municipal council. So the target audiences here are multiple, and they are being thoroughly calculated by Russians. So based on what you've written, there is a systemic professional campaign with a classical tricks for adaptation to different target audiences that we should not neglect. Dear friends, do we have any questions on the floor? Please get involved in our conversation. Good afternoon, Svitlana Tkachuk, Ukrinform. Thank you very much for such an intense and comprehensive discussion. I would like just to ask you for details. Have you documented any propaganda messages that were built specifically by Belarus, or are they just geography experts? And another question about the tools for debunking of Russian propaganda messages inside Ukraine, and for foreign audience, are they the same or should they be different? Thank you. Thank you very much for this question. I would like to start with the first question about Belarus. The Belarusian propaganda usually picks up the narrative spread by Russia. So as I mentioned at the beginning, Russia is the starting point, and then the narrative starts migrating. On the other hand, I agree with what Mykola has said. Within one narrative, there may be a couple of messages targeting different audiences. For example, Russia needs to influence the Belarusian audience as well. They can influence by their channels, by Belarusian experts, so pseudo-experts. So it's the choice of the propagandists. And if you can repeat your second question, I was asking whether the debunking tools, the tools for debunking the Russian propaganda messages, are they the same for Ukrainian audience and the foreign audience? Well, when we talk about the healthcare system in Ukraine, we urge to use the data from the official sources, the Ministry of Healthcare, the National Healthcare Service, Service for Public Health, and we urge people to use the international healthcare sources like WHO, FAO, when we talk about, for example, food security and humanitarian security, and the resource dovedka.info that was mentioned by Mykola. It's extremely useful as something to comfort you when you've read a lot of provocations about chemical or nuclear threats, when you have specific plan of actions, when you know what to do to protect yourself and your families. You can do some preparatory actions. It may make your head cold and to deter you from spreading those fakes and make everyone around you panic. Well, regarding the foreign audience, I don't think that they may use the same resources, or usually they cannot, because there are localized topics, localized cases. For example, the latest one that I've recalled about the eruption of HIV and AIDS in Europe as a result of as a contribution by Ukrainian refugees. So only the verified data from local healthcare authorities may help in debunking this myth, or like conditional Ministry of Healthcare of that specific country, the CDC or WHO or any local organizations. And also for the foreign audience, there are fact checkers like Science Feedback. They are the members of International Fact-Checking Organization. They have a unit, Health Feedback, and they very intensely debunk the myth related to the healthcare area about the non-efficient ways of treatment. And all the fact-checkers around the world are engaged in debunking the misinformation related to the war of Russia against Ukraine. You have something to add? Well, regarding the first question, I think the answer to the first question was comprehensive. So regarding the tools, I think that those two centers were created in a very timely manner. They can draw ministers' attention to implement some communications in response to fakes. So apart from the platforms that we use in our projects, we usually work very well, I think, for our audience. But talking about the international audience, this research about black transplantology, we've spread it among all the organizations that may be interested in this case, and we actively cooperate with organizations such as Center for Countering Misinformation in Europe and other countries. And when we talk, for example, in Poland, there is a lot of discrediting of our country there. We work with the government security center, and we communicate our messages to them. We don't force them, but they may pay attention to our messages. So it's all localized, as Ms. Svitlana said. They react through their means of mass communication. Mr. Mikola, you wanted to add something? No? Well, I want to thank you then for such a comprehensive conversation. I want to thank all the panelists. It was real profound. As a communication specialist, I want to say that such a synergy of a government and non-government sector, along with the journalist community, provides an intense push to counter misinformation, because I remember sometimes the response to such challenges was a Russian phrase. We were saying that it's not true, rather than providing an algorithm for the people to provide some information to comfort people. It's real classy. We're all happy about that, and I want to thank our journalists for interest to this topic, and obviously I want to thank our armed forces for opportunity to hold events like this. So let's work together for our victory. I want to thank everybody, and glory to Ukraine, glory to the heroes.